welcome to Bloom. I'm Cyndi Edwards, filling in for Carissa today. We are so glad you tuned in today on this Veterans Day. If you're new to Bloom, we are a new TV show dedicated to health and lifestyle. We are here to help your life grow. So let's take this journey together. You'll see Carissa later on in the show in a previously recorded segment. Let's kick things off with a look at what's trending now. Well, there's more evidence this week that what's good for the body is also good for the brain. A new study from Massachusetts General Hospital tracked 8,000 adults. It showed people who exercised more were less likely to be diagnosed with a new episode of depression. Physical activity was even protective for those with a high genetic risk for depression. Both vigorous and lower intensity forms of exercise like yoga and stretching were linked to reduced depression risk. Well, earlier this month, over 20,000 runners took part in the Run Disney Wine and Dine Half Marathon. But for one athlete, reaching the finish line was a very memorable moment. Boyd Dunleavy is today a two-time leukemia survivor thanks to a stem cell transplant over 7 years ago. When he received his diagnosis, he was given a 10% chance of survival. And with a wife and 3 kids, he desperately needed a stem cell transplant. That transplant came from a total stranger, Nathan Barnes, a naval serviceman stationed in Jacksonville. Well, this weekend at the Run Disney race, 7.5 years after the transplant, Boyd and Nathan met for the first time. They rode the Expedition Everest roller coaster together, and then Nathan surprised Boyd by presenting him his medal after his half marathon. It really was an incredible moment. According to the CDC, more than 2 million people who suffer concussions every year. One officer from Texas is using laser light therapy to treat his symptoms. Bianca Castro reports.
All right, goggles on.
For Officer Danny Canetti, the hum of a laser machine is a welcomed sound.
How does it feel?
And a big difference from the noises he routinely hears on the Dallas SWAT training site, where last year a blast so loud knocked him to his feet from 80 yards away.
As soon as it happened, I just remember kind of an intense feeling inside my skull, and actually feeling like a change in pressure. And then immediately after that, it just felt like my brain had been wiped clean.
He was diagnosed with a concussion and returned to work 4 months later. But even then, he says he still didn't feel like himself.
I struggled just to even figure out what to do to get myself to work.
So he says he came here to Advanced Regeneration in Dallas after learning about the potential benefits of laser light therapy. The light from the high-powered laser is said to penetrate into the brain and help heal damaged cells in our tissue. Low light therapy has been around for 50 years, and a study from 2015 says it helped veterans recover from traumatic brain injuries.
My very first time here in treatment, I noticed immediately it's had an effect.
But leading concussion researchers have their doubts. Neuropsychologist Dr. Mark Barisa says not enough research is out to fully understand how laser light therapy can help concussions. And most concussion patients, he says, get better on their own.
When we have a condition like that that gradually gets better over time, it's very easy to look for products that either try to speed that or take the credit for that natural course of recovery.
But since there are no documented side effects, Officer Canetti says he had nothing to lose. And he says after 5 sessions, he's back at 100%.
The brain's an amazing organ, so if there is damage to it, there is hope that you can rebuild that. And I know I've rebuilt mine in a lot of different ways.
I'm glad that worked. Speak with your doctor if you think laser light therapy might be right for you. Well, people who have trouble sleeping may be at a higher risk for developing serious health issues. Chinese researchers followed more than 487,000 people for an average of 10 years, and all had no history of heart disease or stroke. Those who exhibited at least one symptom of insomnia a couple of times a week were more likely to have a stroke or heart attack. The link was strongest in younger people and in those who did not have high blood pressure at the start of the study. The scientists say the study did not show cause and effect, only that there was an association between the two. Well, something new to think about when it comes to your young children and screen time. A new report released by JAMA Pediatrics gives us concerning news about the effect screen time is having on brain development of young children. Screen time for both adults and children has exploded. Now researchers are scrambling to figure out what impact that's having. This new study is the first to show that little ones watching YouTube, cartoons, and games on screens may actually be reshaping their brains. Here's NBC's Kate Snow.
Doctors at Cincinnati Children's Hospital studied screen use, including phones, tablets, and TVs, and its impact on preschoolers ages 3 to 5. 47 healthy kids underwent special MRI scans to map their brains and sat for language and literacy tests. Their parents completed a survey on how much their child watches screens and the kind of content they interact with. The results of those scans on kids who reported more screen time than the recommended 1 hour a day showed lower levels of development in the white matter in their brains. That's the area that connects brain cells to the rest of the nervous system and is associated with how quickly nerve impulses fire, particularly in key parts of the brain where language, literacy, and cognitive skills develop. Kids with more screen time were also more likely to struggle with words and took longer naming objects in written tests.
Oh, this is cool.
It's alarming news for parents of young kids like Julie Stam. Julie's 3-year-old son Jack spends as much as 2 hours a day looking at screens, and he's not alone. American kids typically spend anywhere from 2 to 4 hours on screens each day.
It's terrifying, everything that you do as a parent, and I think we worry about everything that we do for our children.
The study doesn't prove the screens cause the brain changes, and the authors say more research is needed. Julie says she's responsible with monitoring Jack's screen time and doesn't consider giving him any less.
Hopefully we find out that it's not as bad as they say.
That was Kate Snow reporting. The researchers say what's also unclear is whether screens are to blame for developmental changes, or is it because time on screens is taking away from other things like kids interacting with their parents or reading. And that's what's trending now. The doctor is in. Joining us today to discuss Antibiotics Awareness Week is pediatric infectious disease specialist Dr. David Berman of Johns Hopkins All Children's Hospital, along with Katie Namtu, who is a pharmacy clinical coordinator at Johns Hopkins All Children's as well. Welcome to you both.
Thank you.
So I grew up taking a lot of antibiotics because I had the throat infections and the ear infections, and in the case of having a bacterial infection, antibiotics, very important, but really have to be used at the right time. Why is that so important?
Correct. So this, in November, the CDC does an Antibiotic Awareness Week, and that's for the public to become more aware of the appropriate utilization of antibiotics and also to gain awareness of antibiotic resistance. So antibiotic resistance is when the bacteria, they're very smart, and the antibiotics no longer work against those bacteria. So it's important for us to be aware of how to utilize antibiotics appropriately and the certain infections that Dr. Berman will talk about, and that we need to utilize them, and then when to stay away from them, because if we don't use antibiotics appropriately, resistance can further develop, which is certainly a global health threat.
Definitely.
And then furthermore, there's also a lot of unwanted side effects. It can also lead to, when used inappropriately, to doing damage to other organs such as kidney and liver, and there's a lot of drug interactions that it can occur to, even with the things that you get at your local drugstore over the counter as well too. So,
well, doctor, let's talk about when antibiotics really are appropriate and are the best route to go.
Sure. First, I'd like to talk about the viruses.
Yes.
Because most of the time when you go to a doctor, if you're otherwise healthy, you have a viral infection. So in children, they have about 6 to 8 viral infections a year, and you take that same kid and you put them in daycare, you can amplify that.
It's a petri dish, really.
Right, they're petri dish.
Yeah.
They have snot coming out of their nose all the time.
They do, and they bring it home.
Exactly. And there have been studies that have looked at the duration of the common cold. So in adults, we know from a study which was done 52 years ago that adults can cough until 14 days or even longer, some adults. In children, the same study which was replicated where parents kept the diary, the average duration of the cold was 10 days.
Okay.
Which means if you have a cold and you're starting to get better by 7 days and you still have some lingering cough but you otherwise feel okay, you probably shouldn't be running off to the doctor for antibiotics. You never want to go to the doctor for antibiotics.
Right.
If you do go to the doctor, don't expect they're going to give you an antibiotic. You shouldn't be asking them for it. you're going there for a professional assessment. So when you're going there, the doctor might say, okay, you have an ear infection. I think it's probably a bacterial infection. I'm going to treat that with an antibiotic. Or the doctor might listen to your chest and hear something, and they might think, well, you have pneumonia. They're going to give you antibiotics for that. But you should never go to your doctor and say, I want antibiotics. And out in the community, at least 30%, the CDC did a study, at least 30% of antibiotics are inappropriately prescribed where you don't even need an antibiotic. I mean, millions of prescriptions.
And that's what's so dangerous about this, because the more we overprescribe these antibiotics, what is happening to these antibiotic resistant diseases?
So, you know, we're faced sometimes, especially in the hospital setting, where we're left with nothing to treat these infections. And like I said at the beginning of the segment, these bacteria are a lot smarter than even humans developing the antibiotics to fight these superbugs. And so they call them superbugs because they can kind of think they're superpowers because they mutate over time and they become resistant to the antibiotics. And they're very smart, very smart.
For a parent who has a child with an ear infection, I have heard reports where they say, don't try to not give them antibiotics, but your child is wailing in pain and you know that they have an infection. So what do you tell a parent who says, just please give them an antibiotic?
Right. Well, that's a different story. I think, again, depends on the age of the child. You know, a very, very young child or infant, a pediatrician is more likely to prescribe an antibiotic if there's a question that there may be an ear infection there.
Right.
A child that might be a little bit older, there might be a watchful waiting with the pediatrician involved in that child's care, saying, okay, let's try some analgesic, something like acetaminophen, Tylenol,
Right.
To see if that works. But if not, then there might be an indication to use the appropriate antibiotics. Even when you're put on an antibiotic, it should be the appropriate drug selection.
Yeah, they're not all the same, are they?
Exactly. And the appropriate dosing and the appropriate duration. That's a big thing the CDC has been focusing on as well, too.
Finally, I just have to ask about strep, because we hear about that, and you can test for it right in the office, right? And if your child or you, and you've been diagnosed with strep throat, what's the best course of action?
Well, the best course of action is to take the antibiotic.
Okay.
But again, we have to remember that is overtreated as well, too. So when you're going to a doctor, the signs and symptoms of a strep throat, which is group A strep, are having a very severe sore throat and fever. It is not a respiratory infection, so it's not a cough and runny nose. So if you have a cough and runny nose and they do a test on you and it comes back positive, it could be something called a false positive, meaning you might just be carrying it and you might get overtreated with antibiotics. So be aware of that as well, too.
Good advice. Such a good topic this time of year. If you would like more information, visit Dr. Berman's website at hopkinsallchildrens.org. Thank you both very much.
Thank you.
Thank you.
Stay with us. We'll have more Bloom right after this.